section of our presentation. Maybe we can go ahead and proceed. I think maybe it's better if after every lecture the question and answer can be done, since if you will look through most of the topics, they aren't really very closely related anyway. It might be better that after a speaker comes up, finishes his presentation, we can go into the question and answer. So to start our session, we'll have Dr. Sagini.
Yes.
He'll be talking about inferior heel pain in soccer players. It's a retrospective study with some proposals or guidelines for treatment.
Yes.
Professor Raul Sagini.
Is a retrospective study with a proposal of guidelines for treatment. So the soccer is sport involving constantly changing complex movement patterns, walking, running and spinning. Sudden changes in direction, jumping and body contact require a high grade of coordination and body control. Overload disease of the foot is perhaps 50% of all overload disease in soccer players. And heel is susceptible to all the running, repetitive jumping and landing demands, especially during soccer. So, according to the topographic classification, it's possible to distinguish 5 kinds of heel pain: diffused, lower, medial, lateral and posterior. So this is a classification of Bardelli from Italy. But also Thomas, in a revision of some years ago, divided into main groups: plantar and posterior heel pain. And the causes of heel pain is mechanical, neurological, arthritic, traumatic, and others like tumor, infection, vascular disease. So, plantar heel pain for Thomas include plantar fasciitis, heel-spur syndrome, and plantar fasciosis. And for the plantar fasciitis, the normal peak of incidence in general population is from 40 to 60 years. And the risk factor include running excessive or increasing running distance and other. But very important is the plantar fasciitis is caused by repetitive prodatory stress that increase tensile forces of the plantar fascia. So we carry out a retrospective epidemiological